Joining us tonight, Fox News medical correspondent, Dr. Marc Siegel. Doctor, good to see you. Let's start with this virus, and I want to get straight to Dr. Fauci and the divide between it seems, the task force and Fauci, as well as the president. What is Fauci doing, if you can tell us? Talking about end of the world. It's extraordinary. He says that there are more deaths. Dr. Birx says there are fewer. What is going on?
First of all, the overall trend in the United States is fewer cases. We still have some hot spots left, Lou. We're looking at Minnesota. We're looking at Illinois and Texas. But New York has shown dramatic improvement. COVID wards are closing, even in my hospital. New York is definitely on the downward side of the curve. There's been a lot of social distancing. My concern is about the word lockdown. Lockdowns are antiquated terms. We imported that from the Middle Ages. We tried it in St. Louis in the 1980s.
Mark, excuse me. Forgive me. I don't want to get into that right now. I want to get to the point that I asked. What is going on with Dr. Fauci talking in one direction, Dr. Birx talking the opposite? And why is he talking in direct opposition to the president he is ostensibly serving?
He should not be. He's there to serve the president, and he's more of a virologist than a public health official. But if he's going to look at the larger picture, you already said what the larger picture is. Look at all of the medical care that is not occurring right now. No prevention. People afraid to go in emergency rooms. Lou, much worse in April than in March, by the way. 4 out of 5 people in March were afraid to go to ERs. I can't convince anybody to go to an emergency room. A 90-year-old last week with an acute gallbladder attack, I was begging him to go to the emergency room. Heart attacks, afraid to go to the emergency room. The whole healthcare system in tremendous disarray. We have to look at the larger picture here. And the larger picture is, what impact is it having overall? The virus, we're starting to get some control over.
Well, and Dr. Birx has said that basically she can't trust anything the CDC is telling her. And that, by the way, is a complaint that works its way into the society at large. The CDC has been uneven, let's say, in its performance. Your thoughts?
Well, first of all, the CDC was way behind this from the beginning. They underestimated this, and I got a lot of calls about this from the CDC saying the president is overreacting, the administration's overreacting. Well, the CDC didn't have the testing right. They still don't have the testing right. They've always thought less of this virus than they should have, and that's led to a huge problem here. I think the president's been out in front of this. Even today, the president is talking about bringing the military in on vaccines. It's already been set up. The Department of Defense is going to be involved in this. It's a very heroic attempt to get a vaccine as fast as possible.
Dr. Marc Siegel, we're out of time. It is great to see you, and always we appreciate your clear voice.